I have a lot of cramps and pain from the hips down. Toes and feet are arthritic, and I can't clip my toenails.
Around 50% of adults in the U.S. over the age of 65 have osteoarthritis in one or more joints. These people are 2.5 times more likely to fall, and almost half of those living with osteoarthritis are limited in one or more activities. In rural America, the problem is exacerbated by limited access to healthcare professionals. 85% of rural communities in the U.S. are classified as health professional shortage areas. Getting to the nearest clinic is often a challenge, especially where public transportation is hard to come by.
It doesn't go on Tuesday, or it doesn't go weekends, not in the rural area.
People experiencing chronic pain associated with osteoarthritis often resort to opioid medications. According to the USDA, opioid misuse is on the rise in rural America, even at faster rates than in urban areas. The CDC has recommended non-pharmacological interventions, such as those delivered by physical therapists, as an effective first line of treatment. Published evidence-based practice guidelines also recommend physical therapy as an effective first-line treatment for pain and disability associated with knee osteoarthritis. Unfortunately, people in rural areas are less likely to receive and benefit from this recommended treatment.
One solution is to use tele-Rehabilitation. In-person visits can be used sparingly, and the majority of visits would rely on secure, HIPAA-compliant video conferencing technology to allow the PT to demonstrate and help the patient practice therapeutic exercises safely. Many states don't have laws or regulations that explicitly allow PTs to provide these services. Medicare and other major payers will reimburse physicians and nurses who practice telemedicine, but they won't currently pay for tele-Rehabilitation. In order to convince state legislators, Medicare, and other entities to allow and reimburse for tele-Rehabilitation services, more research is vital.
For those living in rural areas, tele-Rehabilitation would be a feasible and effective solution to promote physical therapy to those in need. The team will be led by Pitt School of Health and Rehabilitation Sciences faculty members Ali Bove, Kelly Fitzgerald, and Bambang Parmanto.
If you do the therapy, if you take care of yourself, you're going to feel better. If you feel better, you're going to enjoy life.